Today, we are going to understand what mental illness means in children and adolescents. Mental illness refers to emotional, behavioral, or thinking patterns that cause distress and make daily life difficult for the child. Just like physical health, mental health is real, important, and needs care. It is not a sign of weakness, poor parenting, or stubborn behavior. It is a health condition that can be treated with the right support. A simple way to understand mental illness is when big feelings, worries, or behavior problems last for a long time and interfere with school, friendships, and home life. Everyone experiences sadness, anger, or stress sometimes, but mental illness is when these feelings become too strong, too frequent, and too difficult to manage. Children with mental health challenges are not doing it on purpose. They may be overwhelmed and struggling to understand or express what they feel. Parents may notice different signs or changes over time, including persistent sadness or crying, excessive worries, or sudden anger. Other signs can be a loss of interest in play, withdrawal from friends, or difficulty concentrating. Changes in eating or sleeping habits, risky behavior, or talk about wanting to disappear are also serious indicators. One symptom alone does not indicate mental illness. But if many signs continue for weeks and interfere with daily functioning, professional support is important. Mental health conditions happen because of complex interactions between the brain, environment, and experiences. Factors like brain chemistry, genetics, stressful life events, or medical conditions can all play a role. The brain controls how we feel, think, and behave. When certain parts of the brain do not communicate smoothly, it can affect mood, focus, and emotional control. Mental illness is not the child's fault or the parent's fault. It is a real health condition that can improve with care. Counselors and therapists help children understand their feelings, learn coping strategies, and build confidence. Therapy provides a safe space to talk and heal. A psychiatrist can assess and provide medical treatment if required. Sometimes medication supports the brain to function better, just like using medicine for asthma or diabetes. When families listen with patience, avoid judgment, and show empathy, children recover faster. In school, we can support the child by allowing short breaks, reducing workload, or providing a quiet space for calming down. Connecting regularly with counselors and teachers and setting realistic goals step by step are also crucial. Schools play an important role in emotional safety and early intervention. Mental illness is treatable. Children can grow, learn, and live healthy lives when they receive understanding and support. Awareness and early identification reduce suffering. Talking openly about mental health creates hope. Children don't need perfection. They need patience, acceptance, and support.